We began 211 Mid-York on January 1st. That's when we started answering the phones. And we had a public launch on February 11th, which is National 211 Day. 211 is an information and referral service that is available 24/7, 365 days of the year. It's free, it's confidential, and it's there to help people who are interested in finding resources to help them solve problems that they're dealing with. So it might be a high school dropout who is looking to find out how to get into a GED program or get into a work experience, or it might be a business executive who has an aging parent at home who needs some assistance to be able to continue living at home. So it's a variety of resources that are listed in our database, and it can all be accessed by calling 211. 211 call center is actually in Rochester, New York. So when you're calling from Utica, New York, and you're wondering how a contact center in Rochester, New York can serve you, know that they are using a database that we have helped them build. We have been giving them the names and all of the contact information, and have had organizations across our area sending in vital information about that organization so that they have the most current and up-to-date and most comprehensive database of health and human service listings that our area has ever had. I find it personally very exciting and satisfying to see finally people have easier access to the answers that they need.
So 93% of our country, the United States, has 211 services. Here in New York State, there were 10 counties that still didn't have 211 services. We currently had 6 call centers in New York State, but Oneida, Madison, and Herkimer counties were not covered until now. We're so excited because now all of New York State is covered by this service. Very much like 911 that takes emergency calls, 211 is the answer to take health and human service calls. And our 211 will connect to all 3 of our 911s in Oneida, Herkimer, and Madison counties.
Most of our listings are 501c3s, nonprofit agencies or government agencies. We are actually unable to list a private practitioner, even in, for instance, the healthcare field. So no one's getting rich off of 211.
The New York State 211, which is the governing board, and the Alliance for Information and Referral Services, which is the certification body, had made a declaration that they would not allow a new call center to be built. And so we were instructed, if you're going to bring 211 to your community, you need to work with an existing call center to provide the service for your community. So we spent a year bidding out the existing call centers across the state, and we selected Goodwill of the Finger Lakes based on not only price and efficiency, but the quality of staffing and the quality of the program that they wrap around their 211 center. Part of bringing a program here is making sure we have funding to sustain it. And United Way is known as a fundraiser in our community, but we're much more than that. It's about the impact we're making with programs like these. We work together with our counterparts around the state to advocate for funding in the New York State budget to bring 211 across the state, and we were successful in doing that for the first year, and we've been successful in obtaining approximately $122,000 for the next budget cycle year from the New York State government. The funding that we get from the state represents approximately 55% of the cost that it takes to operate 211 Mid-York for our 3 counties. And so the remaining 45% has been raised with investments from United Way and will be raised in the future with private donations as well. The biggest part of the cost of having 211 is the actual operations of the service, which is a 24-hour-a-day, 7 days a week, 365-day-a-year operation. There is never a time where you can't get connected to a call operator with 211. And the phones, as mentioned, are answered by certified professionals by the highest quality of service that we could obtain for our community. We're very appreciative of the funding that we have from the state. Come the summer, we will move into resource development efforts to continue raising additional funds to not only have this great service, but to also get the word out in the community for people to be able to start using it. It was really our honor here locally with our United Way of the Valley and Greater Utica area to bring 211 Mid-York to life and to receive the reports every month of the type of things that people are calling for is just everything we could ask for and so much more. It is our mission to bring together people, ideas, and resources to create a thriving community. And when needs assessment after needs assessment showed us that one thing our community was missing was a centralized place to get help when you need it, we knew we had to rise to the challenge and meet that need, and we're doing that now. So when you have a need, just call 211.